Just as children are heading back to school for the fall, President Trump signed an executive order today recommending splitting up some children's vaccine that are currently grouped together. John Ramos has more on the latest recommendation that's once again putting the administration at odds with the medical community.
Americans are living about 10 years longer on average than they did in 1960. And thanks to modern vaccines, some diseases have all but disappeared. But now there is a growing distrust of vaccines among some people. And on this day, President Trump pulled the issue into the political arena.
Nothing bad can happen from what we're doing. Nothing bad can happen.
President Trump's executive order establishes recommendations of only 11 core vaccinations for children under 17, including MMR, a combination dose to fight measles, mumps, and rubella. But not everyone agrees with the order.
I think it's another piece of poorly advised information to give to the public.
Dr. Yvonne Maldonado is a global health professor at Stanford University and a pediatrician for 35 years. The order recommends that MMR vaccine be split up into individual doses for the 3 illnesses.
At 1 year, you should have 5 separate visits for vaccines rather than getting them all in the same day. And I saw this early on, and I've seen proof of it, where they have a vaccination that looks like the size of a bottle of soda poured into a little child's body.
Dr. Maldonado says beyond the exaggeration, the recommendations could interfere with children becoming immunized.
We've had almost 60 years of experience. These vaccines are incredibly safe, but it is very hard for families to come in and get multiple shots for measles, for mumps, for rubella. We would wind up starting to see drops in vaccine coverage for families who can't afford to keep coming in when one visit would do.
But plenty of people are questioning the effects of vaccines, especially Health and Human Services Secretary Robert Kennedy Jr., who said 30 years ago the rate of autism among children was 1 in 10,000.
The rate, according to CDC today in this country, is 1 in every 31 children. In California, it's 1 in every 19 children, 1 in every 12.5 boys. So something happened in the mid-90s that changed our children, and it has to be an environmental exposure.
Again, Dr. Maldonado challenged the truth of that statement.
There are no data to suggest that these vaccines cause autism. The data that is cited or quoted by the Secretary of Health and Human Services and others in his camp is flawed data or absolute outright mis and disinformation. No data.
The order establishes recommendations, not mandates, but it also encourages more parental authority in immunization decisions and directs the federal government to improve vaccine research. Dr. Maldonado says separate doses of the MMR vaccine do not exist at this time and could take years of clinical trials to create.
The executive order comes as the number of measles cases so far this year have already surpassed the total for all of last year. California has reported some cases, but some of the largest outbreaks this year happened in Utah, South Carolina, Texas, and Virginia. And the American Academy of Pediatrics also came out against today's executive order, calling it dangerous. They encourage parents who have questions to talk with their child's pediatrician.